We will now look at the chronic disease templates. If you haven't already done so, go into the template category to make sure all of your favorites are going to be saved by configuring My Favorites and adding the top 6 templates with the asterisks in front of them over onto your favorites list. Once that's done, again, you should be able to choose from the templates on the right-hand side, and we'll choose diabetes today to go through what a diabetic follow-up visit can look like. Again, we're going to see that anything that's in the green or that has any asterisks or question marks are easily added. We can go ahead and specifically click on each one, which will pop up a drop-down very similar to what we've seen in the past, but is specific for that particular question. We can add in our comments that way and click OK. If we are doing anything that asks for any additional complications, for example, and we click on this, if you enter something on the right-hand side, it will only enter that one comment and bring you back. If you feel like there are more problems, you can add additional ones onto the left side, which will give you multiples, and then you can hit OK, and those will then populate into your HPI. You can also then click onto the different areas, if they're monitoring their blood sugar levels. If they are, what have they been? And they'll give you a little note to add in additional features that way. The same question here is answered underneath, so you can choose to leave it up there, or again add it into this area where you can choose a more appropriate value. Going through the rest of their preventative issues, you can find when their last dilated eye exam is by entering it in through here. And again, you can enter all of these instead of clicking in and out of each one by going up to the very top part as well. So you can click onto diabetes and you'll see all these questions listed in order here. Sometimes this can be more confusing or less. I would recommend going through just each question as you're talking to the patient to get a better sense of what's going on. In your preventative vaccines, it gives you the option to enter yes or no. If you do enter yes, it then gives you a drop down to enter when the most recent vaccine was done. And we do recommend, again, even with the the Hep B, you can enter in all 3 dates so that you have a better idea of where things are at. Once all this information is recorded, I'll show you how you can keep it all in play by bringing it forward from previous visits as well. Again, you can enter in if they're taking their ACE or ARB, and if they are, which medication are they using. It also gives you a spot to enter in if they're taking aspirin or not, and this too will allow you to give in a yes or no answer, and then you can enter in what dosing they're taking up on the top here. So that takes you through a basic questionnaire with the diabetes. Again, if you have additional free text that you want to add, you can of course just jump into here and add any notes that you feel are necessary. And then that will again populate into your HPI at the bottom of this questionnaire. Another feature that we added in is also the Framingham risk score. If you fill in these questions, again, you can just click on to the risk area and it'll give you the drop downs, allowing you to enter in what all of their demographic features are. This is not necessarily useful right off the bat for you. However, it will populate into a flow sheet, which will then give us the ability to calculate out their Framingham risk score, which you can then enter into there. The Framingham will then be in the flow sheet area where you can click on the score here. It's not populating for us right now, but if you see when we enter things in, all your information that you just put into your template will pop up in here, and any other lab values will come in directly from the lab tabs, and you will not have to input those. Once you have all these lab values, you can then go into the calculator and then determine how your scores will come through. In the risk calculator, which the URL is in your template, you can populate all the information that you have and then get what the risk score is going to be for your patient. For example, if we just entered in a couple of random numbers, we can see that our risk score is 8.7, which is considered intermediate. You can use this Framingham risk score to then determine what changes you should make to the patient's plan by using what they have in here for additional information and advice. Back on the template, again, you can get out of the flow sheet at this point and look through what you have otherwise. You can then see that the exam is already pre-populated to be normal. Go ahead and click in that and adjust anything that you deem necessary. A diabetic foot exam is also populated, so if you are doing that, make sure you enter those in appropriately. In your assessments, there's two basic possibilities with diabetes type 2 without or with complications. You can go ahead and delete out the one that you don't need by hitting remove, and then moving on into our treatment plan for this. With our treatment plan, again, we're going to be using our order sets, which is in the upper right side here. In here, you can then add in any medications that you feel the patient should be on by going into our diabetes order set. These should have our Healthstat medications already populated, plus some abilities to add in some outside orders that you would take to the pharmacy as well for any type of insulins if your clinic does not carry those. Again, you're clicking on whatever information you need. If you want to add an additional laboratory test to be done, you can just click on the boxes, enter into order. You can do any procedures. For example, if you did the diabetic foot exam, make sure you enter that in there, and that will be part of the billing codes that will pop up as well. If you feel you need any additional referrals for podiatry or you want to send them out for an eye exam, go ahead and get those, and you can order those. And then finally, at the bottom of this, you can also enter in whatever you need for the plan. Right now, there is one pre-populated plan that you can add in there, which will help you go through things to kind of add in any changes you've made or any updates that have been done. So again, you can say if they are well controlled or not, if you have any changes to their medications, blood sugars, double checking that their vaccines are up to date, and that preventative measures are in place. From there, you can then go into your billing as you would normally do and bill as you deem appropriate for the level of care that you've given your patient today, with any additional follow-up if that was not already checked in the order set. From there, everything in your visit should be completed. You can also go up into the flow sheets and check on the diabetes flow sheet, which will give you all that information that you've inputted with this template, including if they're on aspirin, what their last exams are, any vaccines that have been done, and also additional lab tests will be populated in there. So you can check here to add into your typical note, or you can use this as you're kind of judging how they're doing as visits go by. I mentioned earlier, you can also bring forward some of these notes. So what you can do is once this is done and this patient comes back 3 months later and you have a new sheet open, you can always go back into your templates and do a copy merge. And what that will do is actually look at any of the last visits this patient has had, and you can click on that and then bring in your template either through a copy or through a merge to make sure that you have anything old that's been seen before. And that's it for our chronic care templates. The other feature to kind of notice is if they're here for more than one problem, say they also have high cholesterol and then they also have hypertension, you can easily add all those just right into the template that you're doing, and it'll just create a longer list of questions. Some of the stuff does duplicate, so that can be a little bit annoying, but you can get your more specific questions with the hyperlipidemia and hypertension here as well, and then you'll just have to go through and likely delete out some of your Framingham risk scores that are duplicating up on you.